So this video is just about Erik Erikson's psychosocial development theory. It was too long to fit in the next video, so this is going to be all about Erikson's theory. The next clip will describe it, but I can't reiterate enough. You really need to study this one because it is going to show up everywhere throughout nursing school. It's not one of those theories that you can learn and forget. I don't think I can possibly stress to you the importance of this next theory. It will be on all of your tests. It will need to be known all throughout your nursing education. It's going to pop up everywhere. I do have an acronym, but honestly, my best advice for this one is to just study it. We have Erik Erikson's psychosocial development, and this has 8 stages, and it goes from infancy to old age, and this is the most common one you'll see, and like I said, it's going to be everywhere. So this one focuses a lot on your relationship to family and culture, and your first stage is trust versus mistrust, and this is from birth to about a year old, and this is all about the infant needs to learn who they can trust. They need to know that they can trust their parents. And their caregivers, their family, everyone in their environment. So parental involvement is very important in their care when these infants are hospitalized or visiting the clinic. Having their parent there to comfort them is very important. Then we have autonomy versus shame and doubt, and that's from about 1 to 3. And autonomy is they're starting to gain independence. They can walk, they're kind of starting to potty train here, and empathy and guidance is very important in these stages. And when they're in our care, we need to allow them to try and make choices for themselves, as long as they benefit them. And obviously you can't give them any major decisions, but little choices here and there. It's important to involve them in their care. We have initiative versus guilt from 3 to 6, and at this stage they are very imaginative, and they use animism, which is basically they give life to their dolls and stuffed animals and things like that. So play therapy can be very useful when caring for children in this age group of 3 to 6. We have industry versus inferiority, which is from age 6 to 11. And at this age, they start to see how they're going to be productive members of society. And it's very important that we involve them in their care and that they partake in their treatment as much as possible. A good tip is to let them track their input and output, or for new diabetics, make sure they're keeping track of their blood sugars, their blood pressure, things like that. Then we have identity versus role confusion, which is puberty. And all of this is basically, who am I in this stage? They're finding out who they are and where they belong in this world. It's very important to involve them in their care and in their decisions. So inform them, talk to them with the patients in the room, allow them to give their opinions about their treatment. Then we have intimacy versus isolation, which is young adults, which is most of us. A lot of people in this age group are getting married, settling down, having kids. They have a very close circle of friends. Typically they're close with their families, whoever it is that they consider family. So in a care situation, they need empathy, they need intimacy, and it's important to them to involve their family, their partner, their loved ones. In middle age, we have generativity versus stagnation, and a lot of this is these people have families. They have worked all their lives, and now they're trying to figure out how they fit into their social circle. Basically, they need to find a social circle. So our job is to help foster social development if they don't already have involvement in any community groups or a church group or something like that. Then in old age, we have integrity versus despair, which is meeting all sorts of new challenges. potentially death of a spouse, retirement, illness, even terminal illnesses. We need to help them face these new challenges that they're going through. Otherwise, basically, they stay in despair. Again, this one you really just have to keep studying it and looking over it. It's a lot to remember. My acronym for this one is take animals in indigo igloos inside garages immediately. And I know that's hard because there's a lot of I's, but if you can remember that, you at least know where your T and your G are, and you know that trust and mistrust is the first one. Again, this is going to show up everywhere, so be sure to remember this one. So that does it for Erikson's theory. The next video has 4 or 5 more theorists, and then we will be done with the developmental theories. If you have any more theorists that you want me to cover, something that you want me to do sooner rather than later, let me know and I will get that done for you.